Emily. I have the honor of being able to introduce you today. She is here with us to talk about vaccines and where we are in the world. And Emily is the Supply Chain Director and the Vaccine Task Force Coordinator. And with that, we're going to jump right in and have you educate us with what we need to know about vaccines.
Deb, thank you so much for the introduction, and thank you to all of you for participating with us today and letting me spread the knowledge about vaccines and what we're doing from AdventHealth's perspective for this very important mission that's been given to us. Like Deb said, my name is Emily Huffman. I am the Supply Chain Director here at AdventHealth Shawnee Mission, and last November, our Chief Medical Officer, Dr. Botts, came to my office and was like, hey, we're going to start vaccinating people soon. I was wondering if you'd like to help us out with that. He's like, you'll just be herding cats, Emily, like no big deal. So 25,000 vaccines and a couple of Saturdays later, here we are. So it is hard to believe that this month actually marks the year, right? Since we all started staying home and doing everything on Zoom and living through this COVID-19 pandemic. I would like to thank every one of you for everything that you have done and you continue to do to keep our community safe, wearing your mask, listening to presentations about vaccines, washing hands, doing social distancing, continuing to have these meetings via Zoom until we get to the point where we can all gather together in person again, which we're all really looking forward to. As you've probably heard, the best defense against COVID-19 is to get vaccinated. And so we've been, as you may have heard, we've been doing a lot of that here with AdventHealth and with Church of the Resurrection. And so we're going to show a little video kind of highlighting, this video is from the first mass vaccination clinic that we did at Church of the Resurrection, where we vaccinated about 2,300 people this day. So I'll let Haley show that video. This is how we're going to end this pandemic. This is how we're going to get people back out to the community. This is how we're going to get grandmas hugging their grandkids again. That's why today is important. My name is Emily Huffman. I am actually the Supply Chain Director for the Shawnee Mission campus of AdventHealth here in Kansas City. And when we found out that we were getting not hundreds, but thousands of vaccines in to administer to the community, we started thinking about places where we could partner in order to deliver those in the most efficient and fastest way possible. And Church of the Resurrection came to the forefront of our minds as a great community partner that could help us get this done. Today was important because we have 600,000 people that live in Johnson County, and we need as many of those people to be vaccinated as we possibly can. So to be able to give out 2,200 vaccines today to people in the community that are in need, I definitely consider this to be like one of the most important things I'm ever going to do in my career.
Looking at the number of people here that are being served, we're really very impressed with AdventHealth and also Church of the Resurrection. We were very anxious to be among the first, if possible, because of our age. It feels very, very good to have completed the first one. It was important to be vaccinated because we love to socialize and travel, and we have felt a little bit cooped up the last year. So we're very, very excited to have a little bit of a cushion of safety, even though we know we still have to be careful. My name's Cherie Reese, and I work with Church of the Resurrection, and I work with our disaster response teams and our global partners. We put this together basically in 7 days, so we had no idea what to expect. But with phone calls and a few meetings and reaching out to volunteers, it has gone very smoothly. The Advent staff is extraordinarily professional. It's been a blessing not only for us as a staff in a church, but also for our volunteers. They're absolutely loving being a part of it. The goal here between both Advent and Resurrection is just to make people know that they are loved, that they are cared for, and that we're just excited to be a part of the response to the pandemic. We obviously all want to get back to our regular lives sooner rather than later. So being able to partner in such a big way has been a great opportunity to know that AdventHealth and we are hopefully making a small difference in our community.
Thank you for showing that video. It's so strange to hear your own voice like coming across as the voiceover for something like that. So, but that was really a super exciting and just wonderful day. I was tired at the end of that day, for sure. We started vaccinating people at 8 o'clock in the morning, and due to some extra doses that we had that day, I think we finally finished at like 6:45 that night. So it was a long day for sure. So like I said, I am one of the leads for the AdventHealth Vaccine Task Force. And actually, when Mallory wrote these notes up for me, we thought we were at like 16,000, but after this weekend, I believe we're going to be at close to like 25,000 people that have gotten their first dose from us. AdventHealth will continue to administer the COVID-19 vaccines to the eligible Greater Kansas City metro area residents at the Church of the Resurrection. Our plan right now is through the end of May of this year to continue with that mass vaccination model. Like I said, we did about 2,300 people, I can't remember exactly, on that first day. That works out to about 70 vaccines every 15 minutes. We've gotten it down to a science now, really know what we're doing. We know how many people we need to have there, and kind of have that all worked out from a registration, administration, second dose process. I know a big source of anxiety for the patients is really making sure that they're going to get that second dose and that it gets scheduled and that we know what we're doing with that. I know that there's been a lot of stuff about, like, oh, people can't, like wondering about the second dose, but just to reassure everyone, the way that the vaccine distribution works is that when the Kansas Health Department assigns a number of what they're called prime doses or first doses to us, they are also then committing 3 weeks later to sending us the exact same number to complete second doses. So our process for that is when we schedule a first dose clinic, we know exactly the date and time when we're going to have our second dose clinic. And so for the most part, I'd say 99.9% of people walk out of the first dose clinic with an appointment already for their second dose clinic or for their second shot. So that process has worked really, really well for us and definitely decreases the level of anxiety for the patients. So currently, I know I mentioned the Kansas Health Department. We are also working very closely with the Johnson County Health Department, and that's actually who is helping or who is like, quote, distributing the vaccine to us. After the initial round, which was, mostly for like healthcare workers and people in nursing homes or people in hospitals and nursing homes. After that round, which those vaccines all came directly via the KDHE distribution plan, it then pivoted to going more through the individual counties. And so Johnson County asked all their healthcare partners in the KC metro area, like, would you be interested? Are you capable of doing kind of like a mass vaccination clinic to help us with the distribution of this? And we, of course, were like, yes, we would love to do that with you. So currently, up until this past week, we were really focusing on that 65 plus group. Also, like teachers and people that live in congregate settings were really in that first focus of phase 2. We have now moved into phases, it was kind of a tier, it's like tiers, phases. I mean, we're all like, heard all this terminology this whole time, but it's currently opened up to the entirety of phase 2, which is really encompassing people that are in like what are called high contact critical care workers. So anybody does anything in childcare, grocery stores, retail, transportation, and then any activities that are considered critical to like the infrastructure or maintaining of a of like, I don't say society, but kind of essential services that we need to continue. So right now our clinics at CORE are by appointment only. We are using our current digital health system, Cerner, to help us schedule people. So, and I'll kind of go through how that process works. If anyone's interested in receiving a vaccine from us, whether they're a patient or not of ours, they can go to the coronavirusfacts.com. And there's a place there where you sign up for alerts. And when you sign up for that alert, you fill out some information about yourself in terms of just like age and like, I think where you, like, there's some basic demographic information, including your email address. And then we can filter that based on what phase we're in. And then we send people an email that has a link when we have a clinic open that they can then schedule themselves for. That link allows it to be completely contactless. We don't have to call you. You just go in there, you click on your time, then you get a confirmation email and then a registration process from us as well. You show up on the day of the clinic, we find you in the system, and you go in and get your vaccine. Door to door, where I would say most times, including the 15-minute observation, it's about 20 to 30 minutes from when you walk in to when you leave. So really streamlined process. Thank you for putting that up there, Mallory. That's great. So like I said, we are going to continue to use that sign up for alert system to get our schedule out to people. That's the plan for that moving forward, in addition to working with some other populations that I will talk about here in just a few minutes. I will say when we send that link out, the first time we did it, it filled up in about 40 minutes. This last time, I believe it took 2.5 hours. So still going really, really quickly for sure. The slots are, they're still obviously super high demand, lower supply. That's always kind of the situation there. So how is, I'm just going to go through some general questions. We get a lot about the vaccine process, distribution, and all that kind of stuff. And then at the end of that, we can go through any like individual or specific questions that I didn't answer in these facts. So how is AdventHealth managing vaccine distribution? So we are committed to providing coronavirus vaccinations to our community based on CDC and state guidelines and are abiding by the Kansas Department of Health and Environment COVID-19 vaccine prioritization plan. Kind of similar to what the state did when they put out that Ad Astra plan for like reopening. They kind of have something similar for vaccine distribution and kind of the stages that we're going in. As I said previously, our greatest challenge at this time is that our weekly supply of vaccine is not really even remotely close enough to meet the demand of patients who are wanting the vaccine in our community. We are getting roughly 2 trays of vaccine every week, and we're mostly doing Pfizer because we have the capability to cold store the vaccine. We have a freezer that's specially designated just for the vaccine. So we're able to store that. So that's what we are currently giving. And so we get 2 trays, which is about 2,300 doses every week from Johnson County. To put that in perspective, our AdventHealth medical group, our primary care medical group, has about 53,000 patients that are over the age of 65 in it. So you do the math and divide 2,000 by 53, that's a lot of Saturdays that we're going to be continuing to vaccinate people. In addition to the AHMG patients, however, though, we also do feel responsible to providing vaccine to patients for our other non-employed medical providers, previous patients that were in the hospital with us, and then also just, we consider ourselves a community hospital. So people within our community that would be considered vulnerable or maybe have barriers to accessing the vaccine via technology. I will tell you that's like the biggest thing with this vaccine is that you have to have a smartphone or at least an email address and access to the internet to get a vaccine. Makes it's definitely a barrier without those things. So our vaccine task force is working diligently to ensure these clinics run smoothly, kind of like I talked about. It's a little bit more than the herding cats Dr. Botts promised me at the beginning, but we've definitely gotten into a groove with it, and I feel like we're really working well with that. We are truly committed also. I have people come up to me. I've worked almost every clinic except like maybe 2 of them out of the close to, I don't know, over 20 or 30 that we've had now. And I have people constantly coming up to me and be like, at the end, if you're gonna waste a dose, don't do that. And I'll come back, I'll come back and get that dose from you. I am really proud to say that with second doses, we've given like close to like 30 or 35,000 doses, and we have not wasted a single dose. We always give every single thing that we have in a syringe every single time. When we were doing the employee clinics, I would just walk around the hospital and be like, okay, who hasn't gotten vaccinated yet? Come on over and let's get this done. Now we work off of a wait list that we have, and we fill up the slots at the end. So, but like I said, have not yet to date wasted dose, and we're super proud of that for sure. So what phase of vaccine eligibility are we in right now? So like I said earlier, we are in phase 2 of the vaccine, which is people over the age of 65, people who live in congregate settings, high contact critical workers. So that's, like I said, grocery store, daycare workers, agriculture, supply chain, police officers, city workers, those groups of people. Governor Kelly did announce earlier this week that we would be moving into phase 3 and 4 starting next week. There were a lot of counties, especially in more rural Kansas, that had like worked through their vaccine supply and were like ready to start vaccinating those phases for sure. So we'll be starting to look at that next week. Phase 3 and 4 includes more people phase 3 is people who are between the ages of 18 and 65 that have a identified comorbidity. There's a pretty specific list of those. It includes respiratory problems, cancer, heart disease, diabetes, to name a few. That's not an exhaustive list, but there's some pretty specific comorbidities. And then in phase 4, that moves more on to people in public-facing industries that were not covered in phase 2, and then it covers adults with comorbidities that were not covered in phase 3. But the instruction really is that you work through the phases. So as long as we're able to fill up clinics with phase 2 people, we'll continue to vaccinate those people first and then move on to other phases. I will say that Governor Kelly and the executive or the national administration has said, like, don't waste a dose. So if you need to fill up a clinic, if you need to move into the next phase, that's perfectly permissible to do. So for instance, like the end of the clinic, if the only person I had to give it to was a 35-year-old, then we would give it to that 35-year-old as opposed to, wasting a dose. They didn't want people to ever feel like they shouldn't give a vaccine just because it wasn't in the correct phase. Kind of the philosophy has been, shots in arms, not wasting doses, that kind of stuff, but still trying to get it into the people that need it the most desperately first, for sure. So as that works, and I'm sure you guys also heard the announcement from President Biden last week too, that he would like it to be available to any adult that wants the vaccine prior or by May 1st, and it would be open to any adults, regardless of where they work or any kind of comorbidities. And Kansas is expected to be on that timeline as well with our phases by May 1st. At this time, even though the Pfizer vaccine is okay for people that are 16 and older, AdventHealth is we're currently vaccinating people that are 18 and above at this point in time. So as far as types of vaccines, as you probably know, there are currently 3 vaccines on the market. So there's Moderna, Pfizer, and Johnson & Johnson, or that's sometimes referred to as Janssen, which is another one of the companies that Johnson & Johnson works with to make the vaccine. So the Pfizer and Moderna vaccine are both made using a messenger RNA methodology. This mRNA is used to trigger the body's immune system to produce protective antibodies without using the actual virus, which is not what the flu vaccine is. So it's a different methodology than a flu vaccine or shingles or chickenpox or those. The Johnson & Johnson vaccine does not include mRNA. It is instead known as a viral vector vaccine using a common cold virus, which is similar to other vaccines that we're used to seeing and giving. The Johnson & Johnson vaccine does not require the same kind of special -70 freezer that the Pfizer does. And Moderna also has to be frozen. It does not have to be frozen at -70 like Pfizer, but it does have to be frozen. And then once you take those out of the freezer, there's a much shortened shelf life to them. I think the Pfizer one is good for like 120 hours refrigerated once you take it out of the freezer. And I think the Moderna is 2 weeks possibly after you take it out of the freezer. The Johnson & Johnson vaccine, great thing about that is that you don't have to freeze it, first of all. And second of all, it's only 1 dose. So for certain populations, that's definitely a plus. And I'll kind of talk about that actually, because we did actually receive a very small shipment of the Johnson & Johnson vaccine from the Johnson County Health Department. And I'll kind of talk about how we use that here in just a second. So the best vaccine, of course, is the vaccine that you can get. It's important to not delay the opportunity to get a vaccine, no matter which one is offered to you. That's definitely been our message the whole time. Like I said, though, the primary vaccine is our that we're using here at AdventHealth at our clinics is the Pfizer right now. Is there a cost to receiving this vaccine? No, there is not. There will be no out-of-pocket cost to anyone that comes to receive the vaccine through AdventHealth. We do collect insurance information, and if you have that with you, and we do that, but we're not anyone who's self-pay or who doesn't, or if you forgot your insurance card that day, that's never a barrier to getting the vaccine. So we never want that to be a reason that someone didn't get one. So next question, how are you reaching vulnerable populations who may not have easy access to find and register for the vaccine? Like I talked about, the internet is a huge way that people are getting it, so it can be difficult. We know that minority and low-income communities are currently nationally vaccinated at much lower rates than the rest of the population. Our vaccine distribution strategy reflects efforts to reach these groups specifically to help overcome this challenge. So how we did this initially was we have a small task force here that's focused solely on minority and vulnerable population vaccination. So originally what we would do is before we sent the link out for the sign up to alert schedule, we had some identified populations that we knew would have difficulty accessing it. And we actually physically called them and made appointments for them before we released the link out to everyone, so that we can make sure that we got in small numbers, like 20 to 30 people out of like the 2,000 or whatever that we were doing with that. We were able to work with some refugee affiliations that we have here, and we've worked a lot with churches in Johnson County that have identified these populations for us to help us get those people here. Some Hindu churches, a Nepalese church. We've worked with El Centro, which is an organization in Olathe that's primarily Hispanic. And we've been able to get people scheduled through that. So that's worked really well. The next part of that, though, is some of those groups definitely have difficulty getting to Church of the Resurrection to get the vaccine in the first place. That's a barrier for them. So although we have partnered with Johnson County with their transportation services to try to get people there, it still sometimes that's just not enough. When we know that we need to get the vaccine to those people as opposed to bringing them to us. So we started this last night, and this is where the Johnson & Johnson vaccine came in. We did get a small allocation of that, like I said, from Johnson County, and we're trying to be really strategic about how and where we give that. So we have Dr. Gaffney, who is one of our employed physicians over at our Gateway building that works with developmentally and physically disabled adults. She has an entire clinic that's dedicated to those individuals. And so we did a clinic with them last night in a much smaller setting, familiar setting for that group. They all go there for their doctor's appointments with Dr. Gaffney, and it went really well. The parent, it almost makes you cry thinking, like talking about it. I received several emails already this morning passed on to us from the parents and other caregivers expressing their gratitude about being able to bring their loved one to a safe place, and that they were able to get that vaccine and allow them to, because a lot of within that population, those people have not left the house truly for a year. They've been home. So getting the vaccine in that group is super important. We're also partnering with the Matthews Ministry at CORE, which is another group that works with developmentally disabled adults to help get them the vaccine. And then we're also doing, I think, 4 right now clinics, one at El Centro, one at a elementary school, and then one at a church up here at New Haven Church here in Johnson County, and then one at the Shawnee Town Hall. where we're targeting specific minority and other vulnerable populations, offering a way to, like, we're scheduling them not via the email, like we're manually scheduling those people and then doing like 50 to 100 at a time there. We're going to have, like I said, a little bit smaller group, but have language interpretation services, transportation services, and all that kind of stuff. So definitely a need that's out there that we can, that we're hoping to try and meet. So what's next? Like I said, I could talk for hours about vaccines, I feel like. So next question, do I still need to social distance, wear my mask, wash my hands if I've had the vaccine? Currently, the short answer is yes. You should still practice CDC recommended guidelines, even if you've had the vaccine. However, the CDC has recently released that if you are fully vaccinated, which means 2 weeks after receiving your second dose, or with the Johnson & Johnson, it would be the first dose, you may interact with other fully vaccinated individuals without wearing your mask or social distancing. For those who have grandchildren, which I will tell you, when I first day at CORE, I can't, like, hundreds of, I mean, that was a 65 plus crowd that day for sure. Hundreds of people came up to me like, I cannot wait to go see my grandkids. Like, that was the recurring theme throughout the day. It was very touching. It's also encouraged, so people that have grandkids that are vaccinated, it's encouraged that if you are fully vaccinated, you can see other low risk, non-vaccinated individuals like your grandchildren safely. However, because still only a small percentage of our community has been vaccinated, it is important to continue wearing your mask, practicing social distancing, and as always, to wash your hands. I believe I saw this number yesterday, and so don't quote me 100% on this, but I think something like only like 10% of the population of the United States has received both of their doses so far. At Shawnee Mission, like hospital-wise, we're obviously way better than that, but we started our employees back in December. But it's going to be a long road to get to that quote unquote herd immunity where we're able to safely walk around without masks and stuff. So in conclusion, like, truly, I understand, like, anticipating this is like truly the hardest part. But as we were kind of talking with Deb and some of the earlier people before this started, COVID numbers are going down, hospitalizations are going down. So that's very encouraging. We are coming up into spring break, which could be a little bit of a blip on the radar again, but definitely everything is moving in the right direction. Again, I would encourage any of you to access that coronavirusfacts.com to get signed up for the alerts. And as soon as your phase is available, to get signed up for an appointment with us, we'd love to see all of you. So talking, what questions do people have that I haven't answered for you yet? You can look in the chat.
Does anyone have any questions that they want to raise their hand and ask Emily? Any questions?
All
right, Kathy, Casey.
I did have questions, Emily, and as you kept talking, you answered them all. So thank you. You did a wonderful job of answering the questions. I was writing them down as I was thinking of them, but thank you.
The one that I kind of touched base with Mallory a little bit and Deb about this earlier, you know, as we're talking about, you know, being a year out from the like the inception of the pandemic. I just think about, like, as a supply chain director, what I was doing a year ago was having like daily anxiety attacks about how I was going to have enough PPE to outfit the staff here. And like, that's just such a different environment now. And I can tell you that the impact that PPE, or that the impact that COVID is going to have on the PPE and just the general medical supply market is going to be so long reaching. The raw material that makes up medical supplies is about 4 things. And so whether it's going to making an ear loop mask or a surgical gown or a urinary catheter or all that, like, it's basically, it's all plastic and cotton. And so that's definitely going to be a challenge. We're going to just see the effects of this keep on going on for a very long time, in terms of, it might not be, you know, masks or hand sanitizer or those sorts of things are in shortage, but because we've diverted so much of our energy and our resources to making PPE for so long, that other things we're still seeing the effects of that in other areas of supplies and stuff. So also, I was saying this earlier, I probably get at least one, if not an email, I get a LinkedIn message, an email, or a phone call every day with someone with a distributor that has some sort of excess of PPE that they're wanting to sell me in bulk, which, a year ago, I would have been all over that, like, oh my gosh, give me your name, give me your phone number yesterday. And we're actually currently in a really great place here at AdventHealth. We have a plethora of PPE to outfit both our nursing and other non-clinical staff here to keep our patients safe. And we are also working on some long-term plans to avoid what happened last March and April ever happening again, a little bit more of a deliberate pandemic stockpile of very specific things so that we, if God forbid this would ever happen again, or anything that would require that kind of protection, that we have that available for our staff. So,
Emily, I have a question.
Yes.
On the Johnson County government website, they have a request form that you fill out, and you give them all your information if you have asthma or all that kind of stuff. And then I get an email afterwards, and it says, do not fill out any more requests. We've recorded this one, and we will distribute this throughout Johnson County. So, I mean, they kind of frightens me.
Yeah, I think that they're like, that's interesting. I will tell you that, like, I don't get any patient information or any lists from Johnson County. Like the appointments and the people that we're reaching out to, we are doing that on our own. Like it's our like list to fill. We're not sharing lists between AdventHealth and the Johnson Department. That might be because I don't want you to cancel if you make an appointment or something. I will tell you that the first few weekends, that wasn't a big deal. But as that 65 plus crowd got more and more vaccinated and it started going into the pharmacies and stuff, our no-show and cancellation rate got a lot higher. With us moving completely into all of phase 2 and then into phase 3 and 4 in the future, I foresee that being there'll be another, we won't have that quite as much again. But that's interesting that was on there. We definitely in the beginning, and certainly now too, encourage people to sign up lots of places by far. Like I said, the most important thing is shots in arms. So encourage people to get the vaccine wherever you can. I was making phone calls this week to some more people that we'd identified through our medical group that might have a barrier to technology. And I called 30 people on Tuesday afternoon, and I only scheduled 2 of them to get a vaccine because the rest of them had gotten it somewhere else. So, that's actually very encouraging. That means we're doing the right thing by moving on to the next phases of people, for sure.
Okay, we have a question from Teresa Stewart.
Well, my question is how people can volunteer, or do you need volunteers at Church of the Resurrection for Advent?
Currently, the volunteers that we're doing, that AdventHealth is providing, are currently all employees. And then as far as Church of the Resurrection goes, they are currently using their members to volunteer there. So I would have you reach out to Church of the Resurrection directly and see if they have opportunity for that.
Okay.
But currently, as far as for the AdventHealth part of it, we're just currently, because unfortunately, you have to have access and knowledge of our systems to volunteer for our part of it. So, but yes, we love. There's been an outpouring of that as well. People want to know how they can help. I'll be honest, it takes about, from the AdventHealth side, to do a 2,200 person clinic, takes roughly 100 people on my side, maybe not quite, maybe 75, depending on a few things. But I was so worried, about the burnout and about not having people sign up to work. We send out the link, the sign up genie to volunteer or to work the clinics on Wednesday. It's full in a half an hour. People are coming up to me in the hallway and being like, I clicked on the sign up genie and it's already full. When are you guys sending those out? So I know to go look at my email. So, and I will say that I think I have a person that I'm working with at CORE, and she has expressed the same thing. She always has tons of people willing to help. especially the second dose clinic, it is really fun. Like people are so excited and then relieved when that's over. It's a really fun day. It's restored my faith in human condition. For sure.
Okay. Do we have any
and
more
everyone's
questions?
so grateful. You know, like they would, I say 20 to 25 minutes door to door, but they would wait for hours. Like no one ever complains about the wait ever. So.
Any more questions for Emily?
I'm reading something. Thank you, Chris. That comment is wonderful. Yes, and Dr. Gaffney is amazing. Agreed.
Well, I tell you what, if there's no more questions, I want to thank Emily and I want to thank AdventHealth Shawnee Mission and of course Mallory for supplying this information. We are recording this and we will post it to our YouTube channel for the NEJC Chamber. So share this information with other people. It was great information from Emily today. I had about 20 questions. She answered 19 of them. So I
wonderful. Thanks,
well,
Tony. Thank you, everyone. This was a wonderful experience, and I'm so glad I got to do this for you guys today.
And thank you, everyone, for joining us. Watch our calendar to watch our upcoming events. Have a great day.